Hi, I'm Dr. Rick Duplantis, and you are watching It's Your Health, a program designed to give you information and knowledge about how to take care of your health and improve your health. My guest today is Dr. Virasith Rajapho, and he is an internal medicine physician at Our Lady of Lourdes Hospital. He is a hospitalist. And our topic is hospitalists and hospital medicine. So I want Dr. Virasith to tell us about what is a hospitalist, doctor.
Certainly. Hospitalists, basically, we don't have any clinics. We only work in the hospital, and we only see patients that are admitted to the hospital. And, they come in for various issues, mainly for medical issues. But sometimes, for surgical issues, we're also on the case as well, too. And then, for that time, we become the primary care or the primary physician for that doctor. Because a lot of nowadays, because the primary care doctors, they're so busy in the clinic, they can't come to the hospital as well too. So we assume care at that time, and we take care of them. We give them we deliver quality care, and then once they're stable, we discharge them and have them follow the primary care doctor again.
Great. Back in the olden days, if a person had to go in the hospital, their family practice doctor or internist would admit that person into the hospital. They may come in at the middle of the night being sick, if something brings them into the emergency room, and they enter the hospital and being admitted through that avenue. But how is it determined that a person gets a hospitalist or which doctor at this point in time? I mean, the family physician is not involved in the treatment while they're in the hospital. I'm taking it. Is that what I understand? Okay. And the hospitalist takes over the role of that person's doctor and takes care of him. But what exactly? I mean, do you actually treat the patient besides doing the workup, and you actually administer the treatment, prescribe the necessary treatment? But don't you bring in the medical specialists that are needed for that particular patient, and you orchestrate? Kind of how does that all work?
Yes, we do. We have I wouldn't say a list, but we know which doctor don't admit to the hospital. The hospital is aware that. Your physicians are aware of that as well too. But we call in the consultants, based on their problems. Let's say if they come in for gallstones, we call in the surgeon, and we oversee their care. Even with you have different specialists on the case, we still oversee their care. And the thing about hospital medicine is, or hospitalists, is we're there at the hospital all day long, and even at night, so we can deliver care 24/7. We're always available, and that allows us to deliver more efficient care as well too. And but even when like I said, even the specialists on the case, we still we oversee everything.
Well, you kind of give the family practice doctor a little bit better lifestyle. He doesn't have to get up at 3 o'clock in the morning and rush to the hospital. His patient's being well taken care of by a hospitalist, a physician that's very qualified to take care of his patients, and while they're in the hospital. I guess a question I have too about the hospitalist, is it strictly internal medicine physicians, or is family practice doctors? What specialty group or hospitalists in the hospitals here?
A majority of the hospitals are internal medicine across the country, but they do, allow the family practice physician to practice as a hospitalist too. And in some states or some programs, there's even a pediatric hospitalist, meaning that the pediatrician is a hospitalist for the pediatric population, and even surgical hospitalist, which means the general surgeon is also a hospitalist for that.
You're at the hospital long hours when you are on for your hospitalist shift, and but are you in the emergency room, or are you taking care of patients in that capacity, or do you work in the clinic as well, or are you strictly on the wards? Kind of differentiate where you are at in the situation in the hospital.
Sure. Yeah, I'm strictly, on the wards or inpatient rounds. ER, the emergency room physician will take care of those patients, but sometimes, at times, when patients are sick, we come down to the emergency room to see them and admit them from there. A lot of times, we'll just let the ER doctors admit them to the floor, or ICU, or wherever, or telemetry, and then we see them there. But we don't work at any clinics. We don't round on any LTAC. It's strictly just on the ward in the hospital setting.
So as a hospitalist, you're treating a lot of these chronic situations, pneumonia, congestive heart failure, those things that bring people to the hospital at 3 o'clock in the morning, older patients especially, with various medical conditions that, they come in. So your expertise at the level of a hospitalist is more in a more in-depth medicine, I would think. Can you elaborate on that for me, please?
Yes, yes.
I mean, you keep treating beyond the common cold and the scrapes and bumps. You got a much higher level for what you actually do.
Yes, yes. Mainly because, for them to be even admitted to the hospital, they have to be sick. So all of our patients are sick, and a lot of them, have multiple medical problems, not just one. They have the chronic problem of diabetes, uncontrolled sometimes, the pneumonia, the stroke, the even heart attacks. So
Many patients non-compliant with medication that have serious conditions like the diabetes and congestive heart failure, and the non-compliance brings them into the ER and then brings them into the hospital ward where you take care of them at that point.
Yes, we still take care of them at that point. We can't refuse any patient because they're sick. We still have to take care of that problem.
As an internal medicine doctor, the specialty of internal medicine and the board certification process, can you explain the difference between, a lot of people don't really understand the difference between an internal medicine physician and a family practice physician. Both practice general medicine, but it's different from one specialty to the other, from the family practice, from the internal medicine doctor. Can you give me that explanation or delineate one from the other there?
Yes, yes. First off is, internal medicine doctor, usually we don't see patients less than 16 years of age. Whereas family practice doctors, they see everybody from newborns all the way to
pediatric, all the way to generic,
yes,
geriatric,
yes. And then the family practice doctors will also do, in some clinic setting, GYN stuff, pelvic exams. Internal medicine doctors don't do that.
Correct.
We just focus more on the adult patient population, all the way to the elderly. We deal with a lot of chronic problems, and on top of that,
hepatitis C. Things like hepatitis C, the diabetes, uncontrolled diabetes.
Yes.
The serious blood pressure issues, I would think, as well.
Yes, but the main difference is, we deal more with the complicated medical problem, like complicated multiple medical problem patients. Even though they might not be in the hospital in the clinic, but they still have multiple problems that you have to deal with all at one time. And but the biggest difference really is the patient population. We don't see that younger patient population. And
I guess it comes to my next question. What kind of patient would go see an internal medicine physician?
Most of the patients are usually adults looking for primary care doctor, but a lot of them, already have an established chronic problem. For instance, those diabetic patients, hypertensive patients. Because, with diabetes as well as hypertension, those medications need to be adjusted sometimes as frequently as 3 times, every 3 months, so it needs to be adjusted quite frequently. Or a lot of times if it's stable, you adjust it like once a year or so.
Correct. A lot of people would say that an internist is like the traffic cop in medicine, but that's really not true. You do refer patients out to other specialists. All physicians have a lot of help in medicine, in practicing medicine. They can call in a specialist, someone to come into the case and oversee and join them in the treatment of that patient. But, from the standpoint that, the internal medicine physician has that great depth of knowledge. He's a master of every aspect of medicine. That's why internal medicine, is more of an academic and a scholarly field of medicine to go into. And you really have to do a lot of work, of course, to stay up on the constant changes in everything in medicine. So it's quite a challenging role for a physician to practice in internal medicine.
It is, and we have to, stay updated, quite a bit, and the knowledge, is so broad that you have to keep up with it.
Correct. Yeah, definitely. When you can treat those chronic conditions, of course,
Yes.
You really have to know the depth of knowledge of that medicine
Yes.
to the core. We getting ready to come upon flu season before too long. We have you here. We're in the middle of the season, I'm sure.
Yes.
Can you talk to us about the flu? How do we prevent from getting the flu at this time of the year? I know hand washing is important, to wash our hands on a regular basis. And but how do we prevent it? Do you want to talk about the vaccine, the
Yes.
vaccination?
Flu, there's flu, there's two types, there's type A and type B. And, I personally recommend vaccination for everyone. But, a lot of people don't agree with it, which is fine. But if you have chronic problems like COPD, asthma, diabetes, CHF, I recommend them, I recommend it every year, And flu season, it's spread by airborne, meaning that, the patient can spread it to you by just talking to you, sneezing on you, coughing on you. And how do we prevent that,
If you're flying in an airplane to one destination, you're in a closed, contained cabin, and people start sneezing and coughing, and you're exposed to all this airborne, this aerosol type of organisms, traveling throughout the cockpit and throughout the plane itself. You're exposed to all these organisms.
You are,
so, yeah.
you are. And you do, key thing is, hand washing, hygiene is very important. But you can't prevent it, But the flu thing, it'll come on about, once you get infected within a day or two, you develop symptoms, And the symptoms are malaise, fever, fatigue, those things, And kind of like in any other viral illness, this is all supportive care. Now the flu vaccine, will help to prevent that, but it's not 100%, And you can still catch a flu despite getting the flu vaccine.
Correct, yeah, because you really don't know which strand it's a guessing game of which strand
Exactly.
we're going to have that year that causes the flu.
Exactly.
We've got some drugs out there. We've got some anti-viral kind of drugs that can touch the flu. The neuroamidase inhibitors, Tamiflu. You want to talk about that? There's a lot of people think that that's a lot of money for a drug that's really not that effective. It may shorten your span of having the flu by one day. I mean, you're going to spend $150. Do you want to dispel that myth or tell us what?
Yes. The Tamiflu, I think, is worth it, but the key thing about Tamiflu is you have to use it, at the onset of the diagnosis, at the onset of the symptoms.
First 24 or 48 hours, is that
Yes.
correct? I think.
In order for it to be effective,
I
if
see.
you wait 3 days while you're having the flu to go see a doctor, then if you find out that you have a flu, you already lost 3 days, so it won't be that effective. It does shorten the duration of the flu infection. However, you have to use it, within the first 24 hours. But it is effective, and even if you save a day, I think it's worth it because, a lot of patients that I treat that have the flu, they're miserable. They can't eat, they're tired, they can't get out of bed, and they're
Not
very
a good
miserable.
feeling.
Yeah. So, but and I think it comes down to, the controversy regarding flu vaccine. Some people are against it because of the fact that you can still catch the flu despite getting the flu vaccine, and the Tamiflu being so expensive. And a lot of times, insurance company won't pay for it mainly because you have to have a diagnosis of flu, like the nasal
see.
swab, to be
Yeah.
positive, and it is expensive.
Yeah.
You know.
The nasal swab is very costly as well, too, that test, or to that swab.
It is.
Yeah.
It is.
I'm a lay person, okay? Now I'm putting on a different hat here. And I called the doc, I've got the flu. I started the symptoms 3 days ago. What do I do to take care of, how do I take care of myself with the flu? How do I treat this, doc?
How do you treat it is based on the symptoms, and going back, if you're present to a clinic, you see a doctor, a good doctor won't even need to do a nasal swab to diagnose you with a flu.
It's a clinical diagnosis. in
Yeah,
other
so
words.
basically if he takes a good history and do a good physical exam, he can find out you have a flu, and once you have it already, let's say, it's about 3 days out, or for instance, you can't afford the Tamiflu. What you can do for that is, it's all supportive care. If you're having a fever, you take Tylenol, ibuprofen for the fever. If your appetite is poor, which happens all the time, but the thing about it is, anytime you get sick, whether it be flu, pneumonia, or even UTI, the first thing to go is your appetite. It'll come back, but I would still stay hydrated. If you can't eat, at least, have something like chicken soup or something liquid to go down easy, so you continue to maintain your nutrition. And it all has to do with your immune system, how strong it is to fight it off.
Right.
Those,
Clear fluids, I hear clear fluids mentioned a lot. You know,
yes.
stay on clear fluids and, you know, but you need to have some nutrient along the way with that as well, but no solid food, especially with the, uh, with the type of illness that you're having.
Clear, what we call clear fluid is like, clear liquid diet. You can still have like chicken broth or whatnot. It's just that it goes down easier, meaning that
Correct.
if you don't have an appetite, you don't have solid food sitting there, and then you start vomiting it out. Whereas, those clear liquids will just get absorbed faster. Even when you get nauseated, it's already absorbed by the time you want to vomit.
Yeah, I see. Uh, so have you seen a lot of cases of flu at this point in time in the season?
This year I only treated one, this past week in
That's
fact.
not bad at all. Yeah, that's not bad at all.
Uh,
And what is the peak season for the flu?
Peak season actually starts now. It starts like October, and then it starts going up between, November, December, January. Um,
Is it never too late in the season to take the flu shot?
no, it's never too late, Even when it is in March, I still recommend it. Up to the patient, but from my professional opinion, I
Up to
recommend.
March.
Yes.
That's quite deep into the. People would think they're getting ready to come into the spring, and the flu is out of the. They're not going to get the flu in the springtime. But I remember last year, some people that came down with the flu, February, March. But you can't still get the flu at that time of the year, and
Yes.
and that organism is still going around, of course, at that time of the year.
Yes.
And you, to recap, those individuals who take the flu, what's the age group that? So let's say you a healthy person, and so what age group for the healthy, non-chronic disease person should take the flu shot?
Healthy, you could, usually when you can start in the even pediatric population, like, 6, 7 years old. I think pediatrician, do have that option of giving them the nasal vaccination, where they just inhale it. But you can start as early as like 4 or 5 years old, or even 3 years old. Like I said, I'm not an expert in pediatrics, so I can't give you
Correct,
the exact
yeah.
figures.
Correct.
However, for what we use, but the thing about the flu is we use the severity index, meaning that how severe is the flu? Like for instance, if a healthy 26-year-old come into the emergency room with the flu-like symptoms and was diagnosed with the flu, but no other medical problems, that patient can go home, and they just get rest at home and take Tamiflu at home, or take ibuprofen or Tylenol, clear liquid diet.
Some people out there that are afraid to take flu vaccine. They're looking at some of these cases of autism from children taking the DPT type of injections. And can you put us at rest as far as the side effects or potential risk of side effects with someone?
Yeah, I think the biggest risk with flu vaccination in particular, number one is allergic reaction. If you have allergies to eggs and all that.
Correct.
Then you can get a severe anaphylactic reaction, meaning that you're going to shock. You can
And that's going to
develop
occur in a
rash.
short period of time after they receive the injection.
Yes.
Is that
yes.
correct?
Yes, that can occur almost immediately after you receive the injection. But the biggest complication that I've treated, that I came across, was a condition called Guillain-Barré syndrome after you get the flu vaccine. The Guillain-Barré, what that means is, the symptoms that you get weakness from your
The
lower extremities,
semi-paralysis.
your legs, and then it moves up.
Weakness.
Those are the most severe adverse effects of the flu vaccination. Guillain-Barré is treatable, but once you go through that, you don't want to get another flu shot again. But in terms of autism, I didn't. There's really no evidence to link autism to flu vaccination. A lot of times, the autism is diagnosed at around the same time they receive the first vaccination. But when I went through the medical literature, mainly the internal medicine literature, there's really no clear link that has been.
So people shouldn't fear taking a flu shot each year to protect themselves against the flu.
Yes, I don't think they should fear, but but the risk is there.
Yes, I understand.
And the risk is real. It doesn't happen much, but it does. But as a physician, I still would have to talk to the patient about risk versus benefits.
I see.
I mean, if somebody has been healthy, never had the flu before, then I would say, well, the risk outweighs the benefit. However, if somebody that's
Chronic.
HIV positive, for instance, then I would say the benefits outweighs the risk. So
Correct.
it's a balancing act, and that's what it, all about,
It's an
Rick was-
individual call on each patient
Yes,
based on their medical history
Yes.
and what medical issues that they are dealing with, I guess,
Yes.
at that time.
yes, definitely.
Okay. All right, let's wrap up at some high points here about the hospitalists, the internal medicine. We want to give me the high points and recap what we've just said there.
Yeah, hospital medicine, even,
You're going to get a
Um,
good doctor if you have a hospitalist when you go into the hospital, no matter what the situation
yes,
is.
yes, and a lot of patients,
Qualified doctor.
when they go in there, they don't know what a hospitalist is, which is fine, but we're there mainly to assume the care of the patient over their primary care doctor because, they no longer come to the hospital because they're so busy in the clinic. But, our goal is to deliver high quality care efficiently, communicate with all the consultants, the specialists, even the hospital administrator, basically to help with the flow of the hospital.
So you're kind of like a liaison
Yes.
with the other physicians and
Yes.
bring them into the actual treatment of that patient.
Yeah,
particular
pretty
patient.
much, yes, pretty much. Yeah.
Yes.
And, internal medicine, basically, also primary care doctors, and the difference is, we mainly treat adult patients.
Correct.
Mainly, a lot of multiple medical problems, and a lot of good family practice doctors I know, do a good job too, but the main difference is, we don't see
That
anybody
age
under
group
60.
below 16, in other
Yes.
words, you're an adult doctor.
Yes, I am.
For an adult medicine. Okay.
And
And the flu season, we're going to protect ourselves from the flu this year.
yes, I
And,
recommend it. I highly recommend it, but again, it's up to the individual.
Yeah, I understand what you're saying.
So-
And the hand washing, preventative things we can do besides the vaccine.
Yeah,
Kind of recap that for us and
yes,
hand washing and
frequent hand washing with soap and water, those things, and those places that are mainly used a lot, like those doorknobs, the handles to the toilet seat. I would recommend sanitizing that frequently too, because that's how germs are spread, not just the flu, but other viruses as well.
so I guess when we go out in public, we have to be very careful about opening doors and doorknobs and things, going into public restrooms, because probably a lot of organisms, germs, flu bug on there.
Yes,
And
yes,
how long can it
definitely.
survive outside the body,
It can survive about 24 to 48 hours outside the body. But the thing is, it's all about, hand washing afterwards. I mean, you can't avoid not using the doorknob at a public building. But at the same time, when you go use the restroom or before you eat, just wash your hands thoroughly.
Well, you can carry Purell,
That too.
some of these sanitary type things that
Yes.
these gels that you can wipe on your hands and
Yes.
you can kind of protect yourself in that way. A lot of people use that when they go out to eat.
Yes.
In public, they always kind of pass that around the table. If anyone wants to sanitize their hands, of course, in many people, that's what they do to
Yes,
sanitize their hands.
especially if soap and water is not available, those works really well too. So.
Well, Dr. Virasith, we thank you very much for the time, taking your valuable time to come down and talk to us about what a hospitalist is, what an internal medicine doctor is, and give us that information on how we can protect ourselves from the flu this year, that, we stay healthy during this season of the flu, and, that we don't contract. And if we do, you've told us how to take care of this problem as well. Folks, I thank you for viewing the program today, It's Your Health. I hope you have learned some valuable things about internist, hospitalist medicine, and as well how to keep from getting the flu. And if you have the flu, or if you get the flu this season, how to take care of yourself as well. And thank you very much for watching our program, It's Your Health. I want to wish you a very pleasant good evening, and God bless you. I'm Rick Duplantis. Have a pleasant evening.